You're good. You get it.
Well, I'd like to take this time to thank you for giving us the opportunity this evening to help the best that we can with your help, the people and of Greene County. We know at times that we seem to not get the job done that you would like, so that's why we ask you, and we ask in your Son Jesus Christ's name. Amen.
Amen.
Okay, we get to public meeting. It's called to order. Minutes of the meeting dated December 16th, 2025. Need a motion to approve those minutes.
So moved.
I have a motion by Nate, second by Harry. Consent item, CEO contract for Brenda. She has asked for a new contract to be renewed. We have looked at that. Do I have a motion to grant her new contract? Nancy?
So moved.
Harry, second.
Jim
All
was
those in
trying.
favor?
Aye.
Thank you all very much, I appreciate it.
Okay. Consent item, the EBS scope that we are needed to help our pulmonologist in his work with patients. At this time, I would look for a motion to approve that lease.
Motion.
Motion by Tim, second by Harry. All those in favor?
Aye.
Aye. Self-pay discount. This is a motion, looking for a motion to approve the self-pay discount, and the policy is recommended. Is there any questions for Rebecca on that, or do you want to have a motion?
I'll make.
Harry makes a motion. Jimmy second. All those in favor?
Aye.
The IGT budget, we have 1, 2, 3. We go through them one at a time, I guess. The Serenity Spring and Living at Northwood. We have a motion to approve the 2026 budget for Serenity Springs at Northwood. Do I have a motion for that?
So moved.
Motion by Nate.
Second.
Second by Tim. All those in favor?
Aye.
The IGT budget, Serenity Springs Senior Living at Jasonville. Need a motion to approve that 2026 budget. Harry.
I'll second.
Cheryl, second. All those in favor?
Aye.
Consent item, Freelandville Community Home Administrator. Motion to approve Stacy Blue as Administrator of Freelandville Community Home as recommended. Do I have a motion?
Motion.
Motion by Tim. Do I have a second? Harry? All those in favor?
Aye.
Schedule of upcoming consent items. These are things that will be coming up to be approved. There's a radiation safety plan. Brenda, did you want to add any of this at the time? Just say something, or?
No, I'm good.
Okay.
Thanks.
Capital purchases, there's an order there. These are tentative placeholder dates and prices. You can review those. We will be looking at that in February, the MAMO lease renewal, where they're going to renew or purchase. That will be in February. Let's go to number 11, review the write-offs. Rebecca?
This month for the hospital, it was a little bit less than our average, but our average has been just over $1 million a month. It was $963 this month for the hospital. The clinics and specialty clinics were both a little bit smaller too this month. We did really push to get a lot of things posted. Like we said, we were kind of behind on posting due to various issues. So the financials look a little like off for this month, but in total they look where they need to be, like for the year end. So, but these write-offs, if you look at the 2024 averages, we are higher in 2025, which was, I mean, we knew we had to do some cleanup and some things that we needed to work on. I think we have done a lot of progress on write-offs, a lot of things that we have changed, we have tried to fix. It's going to take some time for all of those to kind of all go into effect. I'm hoping in the next year we're back lower than what our 2025 average is. That's what I'm after. And right now the average for 2025, like per month was 1.1. If you see it on the right-hand side there. And if you look, I mean, it kind of fluctuates a little bit, but you hang right around that 1.1 mark for 2025. This month, the 963. In December, you have holidays you have to kind of go around, people vacationing and things like that, so there wasn't a lot of actual time to work on them. I don't know that do you have anything else you wanna say?
I do wanna say one thing though, that policy that we just, or the policy that's on here, that
Mhm.
we just approved, how will that impact this? Because will those discounts be counted as will they fall in here?
I wouldn't add them to this,
That,
just because.
in my mind, that's not a,
It's a
bad debt,
contractual.
it's a contractual in my mind.
Okay.
You can't use them as,
So, they would be in a different place on the financial statements, it would not show up here as a write-off.
Well, like the self-pay prompt pay discount shows up on here, so those won't show up this, like that though.
I mean, there's a lot of those that show up here that I always just thought maybe were information for the board. I wouldn't consider those a write-off.
So that's probably something to think about is that the
Okay.
new year starts is,
Where do we wanna put that?
yeah.
Yeah. We also show on here, if you look on the bottom left-hand corner, there's like a settlement agreement discount. So, we just started that one in 2025 so that we could, if we've agreed to something specific, we give them a very specific discount, that's where that falls. So that, to me, I guess you could consider it a write-off. I mean, that's why it's shown up here. We'll have to talk amongst ourselves whether we want it to show up here or not with those others sitting there. I don't see it as a write-off, I see it as contractual.
Good, well, I couldn't see with my glasses here, but pre-certs and filing limit,
Yeah.
up, down, I can't see it.
We did have a very large claim that was
Oh.
almost 51,000, on the filing limit, it was from 2023. We've appealed and fought and tried to do several things, and it's just, we haven't gained any traction, and sometimes you have to cut your losses.
So the filing limit was 54,000 for December.
For December.
Okay, so what caused that to get into the filing limit?
We appealed it several times, and then finally, after, numerous times, then you're finally just at your limit.
Okay,
So they say you have to submit a clean claim within a certain timeline. And if we've submitted that, what we believe is a clean claim, and then they deny it, then we appeal it, and then they deny it, you only have that window
so
to,
they don't move the time up? Okay, they leave it at the original time you sent the claim in?
They
everything
usually
is
have
in.
an initial filing limit and then a corrected claim filing limit.
Okay,
But then a lot of payers, you only have so many appeals, like a level 1 appeal, a level 2 appeal.
okay,
There's only, so many appeals you can do.
right,
Everything is in their favor.
And the bad part about this, when she's talking about appeals, you're appealing to the people who denied you in the first place.
right. Okay,
It's not like they have like a separate, department or something, that's not associated to that company that you're appealing to. That's the unfortunate part.
okay. Any questions for Rebecca? If not, I need a motion to approve the write-off.
So moved.
So moved, right, Nate made it, Jimmy second, all those in favor? Nay? Okay, admin report, Brenda?
Yeah, so just a couple of comments here today. For the clinics, someone said, I've always received great care from Ariel. She's easy to talk to and knowledgeable. She's been very instrumental in getting my health back on track for the last 5 years. Very grateful to her. For surgery, someone said, Ben S. was so helpful in so many ways. He was the kindest, most professional RN. Anything I needed or asked for, he was right there. I want to put him in for a Daisy Award, and he truly deserves it. From the time I got there till he put me in my vehicle, he was always there to help. I believe the healthcare profession needs more like him. I can't even say enough of how respectful and helpful about this man. And Ben is one of our OR nurses. And for opportunities, we've gotten a lot of feedback about just the entertainment in the hospital is not very good, that our TV quality is poor, that we don't have very many channels to watch, that it's kind of hard to navigate. In the new ICU, our entertainment that we're trying out is to have these wall-mounted televisions that actually swing around their screens, but they're actually touchpad. We're switching from Comcast to DirecTV, which is gonna be a pretty significant savings for us, actually. And with that, it'll be more of a digital versus coaxial cable. So it's better quality. It'll be on these TVs that are right in front of the patient, that they swing around right in front of them, and then they can also access other things such as patient education and games, actually on this little screen right in front of them. So it's actually a pretty decent sized screen, it's like a 22-inch screen. So we are putting those in the new ICU, and then that's sort of our pilot to see how they go, and then it is in our budget to expand that to other areas of the hospital as money allows and time allows. So that's one of the things we're trying to do, at least to address some concerns we've heard from patients.
Everybody will be checking in.
Thank you, Brenda. Any
Sunday football.
questions, comment for Brenda on the
We're not getting ESPN, no football. Ed said everybody's gonna check in to watch a game.
Probably will.
We don't wanna get heart rates up, and depending on the game's going, we shut her down.
Okay, December financials, Rebecca.
First off, I wanna make sure you do not wanna approve these. These are kind of informal until the audit is complete. We will ask for a formal approval of the audit, which will have the final complete numbers on there. But, December had 2 payrolls, just under, between 1.2 and 1.3 each one, 2.5 for the month. We did issue a lot of payments in December. We had some things that were due, like kind of right at the beginning of January, including the bond payment. The semi-annual bond payment was made. It was entered in December. I think it actually paid out in the first part of January. And the charge amounts are listed there. The way the financial report looks, there's a lot of, on the income statement, just after total patient revenue, there's a very large contractual number there, and that's because we really pushed to try and get as many of that log of like postings down. When you post payments, there's gonna be a very large increase in contractuals, because that's basically what you're doing. You're basically posting the cash, but you're also posting what they're saying, was a contractual with the insurance company. So it's a very large number for December, but if you look at the year-to-date, it's more in line with where it needs to be. Just know also there's about 5 year-end entries we have not been able to post yet. So that number, those year-end numbers will fluctuate with those, including one of the bigger ones will be like our IBNR entry, incurred but not, that's basically with our self-insurance, our self-insured, and then as well as our AP, like we go back and we have to look at dates and things on invoices to make sure that all of the expenses belong to 25 are booked inside of 25. So that's 2 of the bigger entries of the 4 or 5 that we have left. So things will change based on those entries being made and the audit being completed.
How about do you think, when is the audit supposed?
The audit, they have started like their planning part of it. I don't know that we have a final date. They haven't given me dates yet. They usually come, for some reason they wanna come around spring break. But usually it's March or April timeframe is when they actually show up, for their kind of what they call their final kind of run through or their final audit.
Okay.
So I will let you guys know when we schedule that, but usually it's right around like the end of March there, right around spring break is when they wanna come.
They also start their cost report work, they're doing all of that now too, so.
Cost reports in conjunction, any dish related things are in conjunction, so we've got 3 projects going on at the same time, trying to get them all out the door. The cost report is due May 31st, so they kind of do that in conjunction with the audit too. So
Any questions for Rebecca?
What do we deposit this month?
I'll pull that here. Oh, I'm so sorry.
go down.
Oh, you want the cash flow. So right down here.
Go up. Cash received from payers, 7.9. So that's what we would have put in our, But if you can see, you know, you go down through there and it goes out just about as quick as it comes in.
Sure.
But this is our net cash flow down here. So
Net cash flow is at the bottom, yes.
So you positive or negative?
It's positive. We are in a better spot than we were like at the beginning of last year,
Okay,
cash wise.
okay.
You did a good job, man.
Hey, no, I think that'd be you, maybe. Last
You
year.
do it. You do
Oh,
it
no, it'd
fair
be
now.
me.
Yeah. I give credit where credit's due.
Yes, you did. Okay, so we wait to approve these.
I would wait to approve these. I just wanted to make sure you still saw something,
Right.
where we're at now.
Okay,
And then you have something maybe to compare back to if you have questions.
okay. Credentials report, Dr. Gamble.
The credentials are listed and they were approved by the medical staff. One addition is for the nurse midwife. She does, have recommendation to approve the ability to do medical screening exams or an emergency delivery if she would be present.
Okay. Any questions for Dr. Gamble? Okay, I need a motion to approve credentialing. Harry's motion. Second?
Second.
Second. All those in favor?
Aye.
Nays? Okay, building and grounds report. Got Rick down there. Nothing? Kyle, you got anything?
No.
Okay. Finance and Planning Committee report. Rebecca?
Nothing.
Governance and nominating, Jimmy?
Nothing.
How about Brenda, Green County General Hospital Foundation?
Yeah, so just one thing, when we had a grant from Smithville to support our Sweet Dreams baby bundles, and with it was regarding patients who delivered at Green County. So we had to pivot with that grant, went back to Smithville, and they have agreed to fund us for a Lucas device. So Lucas device is it does automatic chest compressions, so we can use it. It will help reduce staff fatigue. It'll do good quality chest compressions. So it's only used during a cardiac arrest kind of event, but. So we have purchased the Lucas device, and the grant funding, it's about $17,000 that we're getting from Smithville to purchase that device. So very grateful to them and thank the Smithville Foundation if you see them. And also Shandy shared, and Shandy did a lot of the work on making sure that all got taken care of, so kudos to Shandy on that. But then these are the statistics for 2025 with the foundation. For Project Give particularly, we have 25 requests that the foundation completed that totaled $8,400. For patients, we had 46 requests that were completed and that totaled about $8,100. And we did 10 different projects that totaled $19,000. Our 2025 Project Give request total was $36,000. And for 2025, we had almost $23,000 in payroll deductions. And we had $814 that came through apparel proceeds. So when we sell shirts, if you see our logo shirts, a portion of the proceeds of that go towards Project Give. And that $23,000 that you're seeing there in terms of deposits, that's all from our employees. That's $23,000 that our employees are giving to support other employees, projects within the hospital, and patients that have a need. So that's I think a pretty big gift from our employees. So.
And I want to say too, we did kind of a push at that holiday event. Shandy and I sat at a table, and we kind of did a push, and so that has now increased. Like the average amount of money we get has gone up per pay period. So we've encouraged people to give a little more.
Okay.
So
Well, I think you should let the employees know from the board that we really appreciate that. Thank them.
I'll do that.
Okay, any questions for Brenda or any comments? Okay, medical staff report. Dr. Gamble.
The medical staff met and had a normal meeting. We did approve bylaws changes and rules and regulations changes that pertain to the transition in the OB maternity unit. Those will be presented for next time to be approved here.
How overall is the feeling with yourself and the physician with OB by now? I mean, I know it's just like me. You don't like it, but are we accepting it or getting along all right?
It's mixed. We have some staff change with it. We also have some of the physicians have been very reassuring to the nursing staff. So that was helpful.
Okay,
So, but it's mixed.
right, right. Okay, we just make them aware that none of us really like the decision either, so. Any questions for Dr. Gamble?
Well, I'm gonna clarify too, when Dr. Gamble is saying mixed emotions, no one wanted to see OB closed, so that emotion is not mixed. The mixed emotion is the anxiety about the
Right.
possibility of delivering a patient in the ER. That's what's mixed, some providers are more comfortable with it than others. And just like amongst the nursing staff, that's mixed too, some nurses are much more comfortable with the idea of having to deliver a baby than others, but I think there's baseline anxiety there.
I'd just like to add a little bit to that too. Speaking with the EMS director this morning, the EMS has taken steps to be prepared for if they do have to transport newborns on a emergency basis and things like that, so they are preparing for that also.
Good.
Does Deaconess still have their newborn ambulance?
Yep, they have they have a transport team. They have a maternal transport team as well. And Kelly McKinnon, she's been working with EMS to do training with them, and she has them on her regular training schedule too, so. We're gonna be doing a lot of education to keep people up to speed.
She's being well received.
Oh, yeah,
Yeah, so the whole thing is, it's a big undertaking, even to shut something down, it's a huge undertaking. There's a lot of ripples in the pond.
Right. Yeah. Okay, public comments, anybody from the public here, Brenda, Tell?
not that I'm aware of.
Old hospital business, have any old hospital business anybody wants to bring up? New hospital business? Okay, we need a motion for affirmation of the executive section of trustees, we met, we decided nothing, okay.
So moved.
Motion. Harry, second by Nate, all those in favor?
Aye.
Need a motion to adjourn?
So moved.
And a second.
And a third.
Adjourn. Thank you.